Well, great. Hello, everyone. And looking forward to talking to you this afternoon. And so I only have 30 minutes, so we better move ahead. Could I have the first slide that is an overview? And, assuming that's up there, um, I'm going to give a little introduction, research more generally, talk about modeling the relationships, talk about some of the biological explanations, and then focusing on depression in the brain, and finally talk about a couple of psychotherapy studies, one that's been completed and one that's in the future proposed, and then give you some further resources to look at. Okay, so that's that. So introduction. Um, just a couple of words about Ken Pargament, since this is in his honor today. I have to say something about this guy. Um, well, I guess the one thing that I remember about Ken is this time that we were in Florida, I think, at a Dave Larson meeting, and Ken and I snuck away from the meeting. And well, we got a couple of six packs at a local convenience store, and in the parking lot, we had quite a time of fellowship. I can tell you that. So, anyway, this is the kind of guy that we're celebrating today. So let's move on to a little bit more substantial issues. Um, okay, so really, I think the role that religion plays in health more generally is going to somehow relate to its role in helping people to cope with stress. Um, it's just a way that many people cope with the kinds of problems that we all face in life, which are, stressful experiences related to our family, our health, our job, and these situations are a lot of uncertainty is present in those situations, fear, loss of control. And religion is a very powerful way of coping with all of that. At least that's what people report, and that's what quite a bit of research is showing. So I think it's gold nugget number one is that mental and physical health consequences of religious involvement are at least partly a result of religion's ability to help people cope with difficult life situations. So if you haven't moved to that slide, go ahead and move to it. So clinically, how can we identify and strengthen a person's religious faith to help them to take advantage of and more effectively use their religious beliefs and practices as they are coping and adapting to life problems? So I think that's the major task. How do we help people to do that better? Using their own religious faith. Next slide. So, what are some of the possible results of religious coping and religious involvement? I'm going to summarize this research that we summarized in the Handbook of Religion and Health up through 2010. So, here is kind of a slide that illustrates. Next slide. And like here is, you'll have to progressively go through these slides, but there's like been over 3,000 studies, and you can see that these are complex results. There's a few of those. There's 250 studies that show that religion is actually related to worse health, worse mental illness, more disease. And there's a few studies that show a trend in that direction. And then, another 250 studies or so show that, some religious variables are associated with positive results and some with negative results. And, but the vast majority are showing a statistically significant relationship between religious activity and better health, better mental health, social health, behavioral health, and physical health. And of course, a number of studies show no association. So that's kind of a summary of that research out there. Now, go ahead and move on to the theoretical model for causal pathways. So we're trying to understand this. You can see the kind of a model that people that do not complex they actually are. So in any case, there is the model. We think that at least for Judeo-Christian. Now there are, of course, very similar models for Eastern religions and for secular humanism as well. But this is one that kind of focuses on the Jewish, Christian, Muslim view of God. And basically this idea of attachment to God seems to be very central to really the source of the benefits that we see from religious involvement. Now, that's nurtured within a faith community, and it's expressed in terms of religious rituals, religious practices, attending services, praying, reading religious scriptures, uh, religious commitments, religious experiences, and religious coping. Now, all of that we kind of equivalate with, equivalate, whatever the term is, the same as spirituality. So I know that's a little controversial here, but my view is that, and I know a lot of people, most people don't agree with me on this, but basically I think religion and spirituality are the same. For me, that's the bottom line. Now, I have a very broad view of religion. As you can see, it involves not just institutional religion, and in fact, a group like AA, Alcoholics Anonymous, in my perspective, is actually the ideal form of religious involvement because it has to do with a surrender to the higher power, as one understands the higher power, and a commitment to caring for your brother, loving your neighbor by sponsoring someone and helping them get through the challenge. So what more could you have that could be religious than that? So in any case, that's what I mean by religion and spirituality being equal in my mind. I think that, spirituality ought to have some connection to the transcendent. If you're going to call it spiritual, there ought to be some connection there. It may be maybe a pretty loose connection, maybe a searching for the sacred, the transcendent, but there's got to be some connection. If there's no connection, let's just call it something else, just to keep things clear. After all, we are doing research here, right? And you got to be pretty clear and specific when you're conducting research. And you certainly don't want to, confuse spirituality on one hand with mental health on the other, especially if you're going to look at the relationship between spirituality and mental health. Otherwise, you're going to always find a relationship. If you define spirituality as meaning, purpose, hope, optimism, connectedness with others, if you define spirituality like that, sure, it's going to be related to better mental health because that's how you measure good mental health. So in any case, um, let's get back to this model, and I'll get off of my soapbox here. So religion encourages healthy behaviors, healthy lifestyle decisions, and it also enhances the psychological traits or virtues. When I don't know, some of you might have gone to like Sunday school. Well, in Sunday school, I remember, they were focusing on forgiveness, honesty, courage, having some self control, being altruistic, humble about it, grateful, patient, and dependable. Those are the kind of things that religion kind of drills into you. And of course, that's good for us when we're like that. That's good. It creates more positive emotions. It enhances our social connections, with in our families and our friendships. And it helps to neutralize negative emotions like depression and anxiety. And of course, all of that is good for your physical health as well. Positive emotions, less negative emotions, and social connection, social support. Lots of studies showing these physiological connections, better physiology, and consequently better physical health, and as many studies show, greater longevity. Okay, so next slide. nugget number 2 is that religious involvement is related to better mental, social, behavioral, and physical health. Establishing and verifying a model that describes the causal directions is important. The effectiveness of clinical interventions may depend on at what point in this model that you want to intervene. So that's why it's now that model I was showing you is not proven. There's plenty of data supporting it, but nobody's ever really tested the whole model. It would be pretty, it would be a long survey to do that, have to be done prospectively and all of that. Okay, so next slide is research now being done to understand the underlying biological mechanisms explaining why religion ought to be related to better health and greater longevity. Where we completed a study recently looking at religious involvement in telomere length. So I want to just say a couple of words about that. Now, like the telomere is at the end of the chromosome, and as the cell divides, the telomere gets shorter and shorter. And it's kind of the length of the telomere is an indicator of your longevity. So people who have telomeres, they got less time to be around. Those with long telomeres, they are like less susceptible to age-related diseases. So that's what that telomere is about. So, if people cope better, we do know that stress is related to shorter telomeres. We know that from many, many studies done over the last 20 years. Now, why shouldn't religious involvement, if it helps people to cope, why shouldn't that be related to shorter telomeres? Because it reduces stress and all of that. So that's the hypothesis. And in our study, we had 250 caregivers, stressed out caregivers, and we measured their telomere length. And you can see that with increasing age, from that slide there, you've got shorter telomeres, as you would expect. Now, what about religious involvement in telomere length? Next slide. Well, so we very carefully measured people's religious involvement, and we, multi-item scale. I think it was like a 40-item scale, and we divided it up into tenths. Whatever it's deciles. Yeah, and then we looked at telomere length, and we plotted their telomeres based on their level of religious involvement. And lo and behold, who has the longest telomeres? Well, the absolutely non-religious. Okay, so that's, you wouldn't expect that, but the data, you can't always control your outcome. So those who were really, really not religious. Now, of course, you had to be really not religious to have this benefit of longer telomeres. Next slide, because if you drop that first 10%, you find a very nice, positive, significant relationship between telomere length and religious involvement. And so, anyway, I guess the conclusion here is you either should be a very devout atheist or very devout on the other side of things. So, and anyway, so that's that. So gold nugget number 3. If these findings are verified, of course, this is like the first study that's ever looked at telomere length and religious involvement, but if that's verified, then there may be a U-shaped relationship between religious involvement and telomere length, and correspondingly to illness vulnerability and mortality risk. So now, devoutly non-religious people may do best with completely secular interventions. If they're not at all religious. For those who are even a little bit religious, though, interventions that tap into religious resources may be beneficial to health based on, this one study. Okay, so let's quickly look at depression in the brain. So we know that depression is one of the most common things that we see patients for, and particularly those with medical illness, they have a lot of depression. That's the area that I study a lot. So in reviewing that research, basically about 60% of studies show that religious people are less depressed. They recover more quickly from depression, and religious interventions tend to lower depression. So now 6% of these studies show that actually religious people are more depressed, but never mind about that for the time time being. Those are a grade that only about 1/10 as likely are studies to find that religious people are more depressed. But in any case, so there's this great study that was published in JAMA Psychiatry, which is like really hard to get a study published in, looking at the brain of people who are religious and non-religious who are at high risk for depression. So here are the findings from that JAMA study. Um, let's see here. Let's say I'm trying to get my notes here together too. Okay, findings, and you have the brains up there, right? Be sure to have the brains up. Okay, good. So the brains are up there. So you can see on the left-hand panel, those brains have got a lot of red on them, right? And those are the non-religious brains. Okay, now if you look on the right, you see religious brains. So those brains have got a whole lot less of that red, which is good. So apparently from this study, it looks like religion is good for your brain if you're at high risk for depression, that is. Now, of course, you can't conclude that from this study. The design doesn't allow you to, prove that because it's like retrospective study of, MRI scans looking at prior, in any case. But this is a kind of research that really gets people excited because it shows some objective evidence that religion may be making a difference here. Okay, so religion depression might even be different in quality among those who are more religious. Next slide here. We did a study looking at people who were all depressed, and we found that, next slide, that those who were all depressed, even though they had major depression, they had more positive emotions than those who were less religious. And you can see on that slide that positive emotions go up very nicely with each quartile of increasing religiosity. Okay, so gold nugget number 4, religious involvement may protect the brain from cortical atrophy in those at high risk for depression due to heredity or genetic causes. And then the clinical implications are that religious spiritual involvement may do this by enhancing positive emotions, such as meaning, optimism, gratitude, generosity. If that is true, then effective clinical interventions for preventing or reversing negative brain effects may be directed at utilizing patients' religious resources to enhance those positive emotions. So that's something to, think about. All right. So let's look at psychotherapy for treatment of depression. So here's a study that we did thanks to the funding from the John Templeton Foundation, looking at the effects of religious cognitive behavioral therapy for treatment of depression in patients with medical illness. We had 132 patients randomized to either religious cognitive therapy or secular cognitive therapy. And everybody got 50-minute, they had 10 50-minute sessions over 12 weeks, largely over the phone. They were all, kind of disabled and sick, so we wanted to do it over the phone, make it easier. So we had 5 different versions of this religious psychotherapy. As you can see from this slide up there, Christian, Jewish, Buddhist, Muslim, and Hindu. And our friend Ken Pargament was the guy who was in charge of getting everybody to work together here on that panel. So thanks to Ken, we were able to successfully, carry out this study. And we've got the manuals and workbooks for each of these faith traditions up on our website and a training video. So if you want to go to our website, those are the links. Everything's for free up there. Now, we published a lot of papers from this study. In fact, here are there's 7 of them. There's 7 more. So there are 14 studies basically we have published, and there are a couple more still in submission. So here's an example of the findings. So basically, both treatments worked equally well in reducing depression. So you can see from this slide the changes in depressive symptoms over time. Now, the religious CBT did a tiny bit better, but not much. You can see the effect size is 0.10, which is almost which is close to zero. So, but in any case, there was a very slight favoring of the religious CBT. And let's see now, I think I've mentioned this here. So there was in those who were more religious, it was better. So religious CBT worked better in those who were more religious. So there was this interaction between baseline religiosity and treatment group that was statistically significant. Also, and this was Ken's suggestion, that we look at, how religious patients were at baseline and how well they complied with the treatment. And in fact, we found that those who are more religious at baseline were complying with the religious CBT a lot better. You can see the figures, 86% versus 66% for those who were, less religious doing that. So anyway, that was interesting and could help to explain why, in those who are highly religious, the religious CBT did better because they were complying more with the treatment. So anyway, this is kind of expected, but it's always nice to document it and show it in a randomized clinical trial. Now, with regard to now, if you had a certain genotype, you actually did quite a bit better, significantly better with the religious CBT, depending on your genotype. So there was this interaction between the CC genotype of the serotonin receptor gene in the brain. So if you had this CC genotype, you did significantly better. Now also, if you had the religious CBT, your levels of urinary epinephrine went down more quickly if you got the religious CBT, or it's close to quickly. It's kind of a marginal p-value there, but close. Now also, optimism was significantly better in the per protocol analysis with the religious CBT. And again, this idea of religious interventions enhancing positive emotions like optimism that might help to explain the brain changes is something to consider. Okay, so there's gold nugget number 5. Religious CBT is at least as effective as conventional CBT, in those with major depression. For a long time, Freud said, you needed to get rid of religiosity, that it was neurotic producing. So this would show that it's not neurosis producing. If anything, it's at least as good as standard CBT and better among those who are more religious. So anyway, okay, so that's that. Next slide, spiritually integrated treatment that we're developing here for moral injury in veterans with PTSD. Okay, so we're developing this spiritually oriented cognitive processing therapy. Cognitive processing therapy is the treatment used for PTSD in veterans and active duty military. Cognitive processing therapy. Basically, people with PTSD don't want to think about, their experiences. They push them out of the way. They don't process them. So you got to process them in order to, resolve the PTSD symptoms. So what we're thinking is, if you've got moral injury and PTSD, and we think that moral injury actually maintains the PTSD over time, and that's why it doesn't resolve very well. Only 20% of patients actually go in remission, full remission, who have PTSD, even with medication, treatment. But that's, we think, because they're not addressing the moral injury component of the PTSD. So in any case, that's what we're doing. We're planning. Here is the next slide. You can see kind of the theory here. Events like killing, violence to others, witnessing violence, that all kind of transgresses the moral code. And, then you've got moral injury as a result. And we kind of have divided the moral injury into the religious forms and the psychological forms. The religious forms involve struggles with faith, kind of like what probably Julie Exline talked about. And of course, the religious struggles that Ken has been talking about for about 10 or 20 years. Go on that need some religious attention, we think, or some spiritual attention, at least. And then there are the more psychological, forms that involve guilt, shame, self-condemnation that could also be addressed with a spiritually oriented, maybe a broader version than the more religiously oriented form of CPT. So that's what we think, that's what we want to do. So now this next slide is a new book that I have written, and the title of it is You Are My Beloved. Really? So the question is, well, one issue, the reason why I wrote this book, as I was thinking about how we are going to treat veterans and active duty military with PTSD. So I was just thinking about this and the moral injury that this trauma causes. And one of the results of that trauma is this fractured relationship with God. I mean, I think, we don't know this from research, but it does something to that relationship so that it's no longer available to help people to cope. So this book kind of in 24 short 2 to 3 page chapters kind of addresses this whole issue of feeling unloved by God. And where is the evidence of that God loves us? Where is that evidence? In not only in Christian scriptures, but in Jewish scriptures, in Buddhist scriptures, in Muslim scriptures, in Hindu scriptures. Where is it? Where in those scriptures does it indicate that God loves us, cares about us? And so that's kind of what this book is about. And then how do you experience that love more fully? And how do you experience God's favor with that love? So in any case, this is written for people who are religious and those who are not religious. And it's kind of a personal book. In my own sense is that this is the best book I have ever written. I know I'm author or co-author of a lot of books. This is the very best. Maybe it's because it's such a personal book, and it reflects a lot of my experience with patients that I treat, in geriatric psychiatry with chronic pain and all sorts of medical problems, and some of the struggles in my own life, kind of, in my family. So I bring it all here in this in this book, and it's pretty cheap. It's only about $8 on Amazon. You know, I tell you, if you have Kindle, it costs $1 to get this book. So in any case, if you've got kids, so this ought to be affordable. In any case, okay. So that's that. So gold nugget number 6 is that developing and testing the efficacy of spiritually oriented treatments for severe psychiatric conditions like PTSD with a moral component may provide hope for those individuals in whom other treatments have failed. Okay, so I'm just about done here. Let me just well, I've got some applications here, but they'll be real quick. So basically, the major application in clinical practice is you want to take a spiritual history. You want to engage patients in this issue in some way, because it has a lot to do with what they're going through. Even those who are not religious, they've got typically religious experiences, that have usually been negative. So you got to kind of get at those too. Now we've got actually 5 training videos on how to integrate spirituality into clinical practice, mostly medical practice, but it also applies to psychological practice as well. And they're all for free, again, thanks to the Templeton Foundation. They were developed in collaboration with Adventist Health. So go up on the website. You can even get CME, although the CME does cost. So golden nugget number 7 is that, as demonstrated above, many applications now exist in the clinical care of patients that are supported by existing evidence base. Spiritually oriented approaches are needed that utilize patients' religious beliefs and practices in the assessment, integration, and treatment of psychological and physical health outcomes. Testing those treatments in randomized clinical trials is really important. Okay, so in conclusion, religion is commonly used to cope with stress. It's related to less emotional disorder, greater well-being. It's related to better physical health as well and greater longevity. Biological mechanisms are now being explored to try to understand this better. And religious psychotherapy is equally or more effective than standard treatments for depression, in those with chronic medical illness at least. And finally, spiritually oriented therapies are needed to treat a wide array of conditions that have not responded very well to conventional treatment. So that's it. Here's a couple of further resources. We've got our e-newsletter. Everybody ought to sign up for that. Just go to our website and sign up for it. It's free. Again, comes out every month, the latest research. And there's our website there. And, if anybody wants a PDF, I'm sure, you maybe having trouble copying all of this stuff down. But if you want a PDF of these slides, happy to send it to you. And then our summer research workshop. If you want to really get engaged in doing research, in this area, we've got 5 days, very intensive. Crams our 2-year postdoc into 5 days. So in any case, send me an email or go to our website. So we've got about 10 minutes here, 12 minutes for discussion.